I always watch that. To me, it's like so neat. I don't know why. Well, I can't say.
Okay. So, yeah, this next unit is all about healthcare careers. So we're going to look at different types of healthcare careers, and we'll look at some very specific ones. But mostly just kind of what does it really take to be in healthcare. And then we'll move on into what are some qualities of like personal type qualities that are important in healthcare. And that'll be, I don't know if we'll do that one next, or if we may wait a little. We may wait till next semester to do it. I haven't decided. Anyways, but this is specifically about careers themselves. What different areas? Because okay, what are some healthcare careers that you guys can think of right now?
Pharmacy tech.
Pharmacy tech. What else?
Paramedics.
Paramedic. Do what?
Pediatric nursing.
Pediatric nursing. What else?
PTA.
Physical therapy assistant.
Neurologist.
Neurologist. What'd you say?
RNs, LVNs.
Nurse. RN, LVN. Radiology technologist. There's a difference in a technologist and a technician. I'll explain that in a little bit. Okay, so good. Those are some really good examples. Most of those that first come to mind are the ones that you're usually in direct contact with, right? You go to the doctor's office, you see the nurse, you see the doctor. You go to a clinic, you might see a physical therapist, right? Most of the ones that you've talked about are ones that you actually see. But the thing is, in healthcare, there's that's just like the tip of the iceberg is what you actually see. To make healthcare work like it does, there's actually a huge number of other people that make it work so that you can, when you go to the clinic, see the nurse, see the physician, see the nurse practitioner, or whatever. So there's a lot more to it than just them. Says chances are you've been to the doctor or the dentist lately. Your grandmother may have recently stayed in the hospital. You just don't know. Every little thing affects what we do. When you guys eat in the cafeteria, okay, there are dietary specialists that work for the school system, not necessarily our school, well, yes, our school system, but as a whole in the state of Texas, that specify exactly how many calories are supposed to be on each plate and what type of foods have to, be offered and aren't supposed to be offered. So those are people in the healthcare industry. Right? People who at the FDA approve what you can or can't eat. What you should or shouldn't eat, I guess is what I should say. They have to do with healthcare. Things that we don't think of. We don't think, oh, if I read on the back of a Dr. Pepper bottle here, it tells me how many calories and how much fat and sodium is in it. Somebody had to figure that out. Some scientist had to go in and figure out exactly how much sodium is there, exactly. All of that is included. So we use this every day, all the time. We just don't always realize it. As there's many opportunities within the world of health science, interested students need to have a solid background in math and science, as well as communication, technical, and teamwork skills. So math and science. Typically in healthcare, you're going to use your math and science skills. Now you're going to use English. Hopefully you'll communicate at some point, right? So you're going to use all those, but specifically math and science. You'll have lots of sciences, and I didn't necessarily have a lot of math classes, but my basic math is really important, right? I want to make sure that I'm giving somebody their correct dosage of medication that they need for their weight or whatever's ordered. Communication, obviously we know that that's important. Your technical skills, can I put in an IV? Do I know how to do that? Can I learn how to do that? Do I have the dexterity to be able to do that? And then teamwork skills. Teamwork is really important in healthcare. That's why we do so many group projects in here. Because everything you do I mean, it doesn't really matter what job you're in. You're going to use teamwork skills. Pretty much every job you ever do is going to be a group project to some extent. Not very often are you actually going to do any one thing solely on your own. Ever. You know, we all depend on each other. Somebody's dependent on you to do your job so that they can do their job. Right? If I come in 7 o'clock in the morning to work my shift, okay, it's going to be important to me that the nurse who had this particular patient before me did her job, so I don't start out 3 hours behind. And it affects everybody else. And then it affects the next person who comes in behind me. Okay, if the doctor has horrible handwriting, and I can't read the order correctly, and I go and do the wrong thing, okay, it's my fault. 1, because I should have clarified. 2, it's the doctor's fault because he didn't write legibly. So teamwork, again, and every single thing you do will be like that. Right? If you work at the grocery store, you depend on somebody to carry your groceries out. You don't have to do that, right?
Right. Well, I've done it before,
but not very often.
Right.
You probably weren't very happy when you had to do that.
I really didn't care. I got to go outside.
But any job you work in, I don't care where it is, you're going to use teamwork skills in some way. Okay? And if you yelled it and screamed at somebody every single time over the intercom to come bag up your groceries, they're not going to want to come help you, right? You get ugly all the time. They might come, but they're not going to have a good attitude. But every single job you're going to use those. And that's why we do that, because even in here, when we do group projects, you're going to have some people who are the slugs that don't want to do anything and mope around, and I don't know what else to call them, slugs. Moving slow. But anyways, you're going to have some people who want to take over everything and not let anybody else do their job. And both of those have their disadvantages. And so there's part of this class is learning how to work together. Sometimes you got to pick up slack for somebody else. Sometimes they have to pick up your slack, and that happens. Happens in the real world too. But in the end, you've got to be more focused on getting the job done instead of just getting your part done. You might run into any problems if everybody was supposed to take one section of the project, and then you come back together and maybe there was a miscommunication, one thing didn't get done because somebody else thought somebody else was going to do it, or one person just didn't do their part, so one other person had to make up for everybody's. Sometimes you just do that, and you have to, and you do it and you move on. Hopefully you don't have to next time. Eventually, somebody will notice if somebody's not doing their job consistently, but sometimes takes a while. It says education and training can be obtained in high schools, community colleges, universities, technical schools. Through these, learners gain knowledge and skills that lead to workplace learning experiences and job shadowing. That's one thing you need to keep in mind, okay? If you want to be a pediatrician, but you only want to go to college for 2 years, that doesn't match up, okay? A pediatrician has to go to school for like 8 or 10 years, okay? Not 2 years. So, you need to make sure that what you're planning on doing or what you want to do matches up with what you're willing to do. Maybe you don't want to go to school for 8 years, and that's okay. But just don't put on your college schedule or whatever your advising thingy that you want to be a pediatrician, because you're not going to get out of school in 2 years with that. So, does that make sense though? You got to plan ahead. Know if this is something you really want to do, you need to get it into your head now. Okay, what are the steps to get there? If you want to be a pediatrician, okay, I'm going to go to wherever university and get my bachelor's degree. And then I know I want to apply to Southwestern so that I can start med school. What kind of GPA do I need to have to get into med school? What kind of classes do I need to have to get into med school? So those are all things that you need to keep in the back of your mind and start, reeling around now. I know that seems silly, but it makes a big difference. gonna say? Oh, job shadowing. Okay, job shadowing is a really cool opportunity for you guys to figure out if whatever you're thinking of doing is something you actually want to do. I've had lots of people who have shadowed and they're like, I really thought I was going to like that a lot more than I did. And so that can be really helpful because once you get into nursing school or once you get into PTA school or radiology, excuse me, at that point you've already done the work to get there and you're taking up a spot. And so if you get there and you're like, oh, this isn't what I thought it was going to be, and then you drop out, one, you've wasted a whole lot of your own time. Two, you've wasted a spot that someone else who really did want to do that could have gotten into. You know, somebody else who really wanted to do that because they only take a limited amount of people. So there's some things to think on. And I'm telling you, I mean, you can job shadow now. It's not something you have to wait to do until you get into school. The hospital in Sulphur Springs, they let kids come job shadow. I think in the past I've set it up, somebody was asking me this earlier, I think I've done this before, but they let a student take their, or we're going to let a student take their college day to go job shadow. So that would be a good, you know, anyways, I know that they'll let you. I know I always have students shadow. We do that every year, and they let them go into Lee Tatum when she went in. When we job shadowed one day in my health science 2 class, he did a C-section, the doctor did, and he actually pulled Lee over and opened up the lady's belly and showed her where the ovaries were and her uterus and let her watch him sew it up and everything. So just a cool experience. So, and there's all different options. I mean, at that hospital, you've got pharmacists, you've got pharmacy techs, you've got CNAs, you've got nurses in all areas, wound care, laboratory, emergency room. They might let you ride on an ambulance, I don't know. So those are all different things. If you're interested in, think you might be interested in any of that, shadow. You know, take a look, you know. And all nursing is not the same, and same with any other job. Everything's a little bit different. I mean, my first semester of nursing school, which is basically the semester where you learn how to give baths, very basic care. You learn about their medications and all that. You might give a medication, but maybe not. I was on the colorectal floor at Baylor. So it was a very interesting area of the hospital to be in. And somewhat smelly. But the thing is, even though my first semester I was like, colorectal floor is not where I want to spend the rest of my life, you know, there were so many other options. So, you know, shadow more than once if that's something you want to do, or if you don't like it the first time, try it, give it another try. So my cousin Megan shadowed at a X-ray or a radiology technologist, shadowed one of them, did that for a few days, and she was like, I changed my mind, this is not what I want to do. So, and that's okay. It's better to find out before than once you get into the program. So, anyway. Anytime you do want to shadow, if you call a hospital in Paris or Sulphur Springs or wherever, just ask for clinical education. FYI, that's something you want to do. That's who you ask for, is clinical education. Okay, there's 5 different areas of careers in the healthcare field. Okay, these are grouped by common knowledge, so basically what it takes to get into that area, and just like what it's about, what their job is really going to consist of. As each pathway provides instruction as a basis for success in an array of careers and educational pursuits. So here they are. Therapeutic services, and I'll explain more in detail in just a minute. Diagnostic services, health informatics, support services, and then biotechnology research and development. Switch my slides around. The health science is the largest and fastest growing industry in the U.S. The healthcare industry employs over 10 million workers in over 200 career fields. And we named like 5 careers a while ago. Okay, but there's over 200 different careers in healthcare, and there's probably more than that. Pretty crazy to think of. Okay, so what word do you hear in therapeutic services?
Therapy.
Therapy, okay? Therapeutic services, this is the group of health science careers that really is hands-on, like your therapist. Most of the ones that you guys said a while ago, those are all therapeutic services. Your speech therapist, your respiratory therapist, yeah, physical therapist, physical therapy assistant, athletic trainer, physician, nurse, CNA, whatever. Anything that, not anything, but most things that are hands-on, where you're actually working directly with the patient, are therapeutic services. And it says they're focused primarily on changing the health status of the patient over time, work directly with patients, and that's kind of the key words in this one. Provide care, treatment, counseling, or health education information. So, work directly with clients or patients. Okay, the next one is diagnostic services. So this is the second little group. So what do you hear in that?
Diagnosis.
Diagnosis. What is a diagnosis?
Figuring out what's wrong with you.
Figure out what's wrong. So in diagnostic services, these are areas where that's what they do. There's some kind of test or lab or evaluation that aids in figuring out what's actually going on. So what are some examples?
Radiologist.
Radiology, radiologist, anything to do with radiology. Well, almost anything. What else? Do what? What'd you say? What were you gonna say? Okay, what about the lab? Laboratory, right? They take blood work, send it off to the laboratory, and they test it for whatever they're supposed to test it for. Those kind of jobs would be diagnostic services. Sonographer, somebody who does ultrasound, another example of this. A pathologist. Anybody ever watched House?
Yes. Love
Okay, he was a pathologist, basically diagnostician, whatever. So he would be in diagnostic services. He did have some direct patient contact, but his was more in the diagnosing research kind of part of it. Trying to think of what else. Histologist. What would a histologist be? Histo. Remember histo from your body?
No. I've got it. Is it
I'll draw it on your person.
the female?
Not histero.
Oh.
Not HY. This one is HISTO.
Never mind.
Histo is tissue. So a histologist would be what?
Person
What
who
is-
studies the tissue.
Person who studies tissue. So they look at a microscope all day long. That would make me tired. I don't think I could do it. They make my eyes hurt as they are.
Yeah.
But anyway, so those are diagnostic services. They basically help in evaluating, diagnosing, testing, etc. Okay, health informatics. This one a lot of times is not the first one that comes to mind when you think about people who work in the healthcare field. What word do you hear in there?
Information.
Information, right? So it says Health Informatics Pathway offers a wide range of career opportunities. Careers range from healthcare administrators, who manage healthcare agencies, to individuals responsible for managing their data, patient data, like medical records, for example, financial information or billing, and then computer application. So healthcare is a big business, and every business, like health-related business, hospital, supply company, or pharmacy, or clinic, or whatever, there's an administrator. Okay, they may not be a physician. They may just be somebody who has their business degree. But they have a place in healthcare. Okay, so any of these areas. I mean, we have some good friends and that we go to church with in Paris, and he's the CFO at the hospital in Paris. You may know what CFO is? Maybe he's not yet, but he's like vice or something, I don't know. Chief Financial Officer. Chief Financial Officer. So his background is not in healthcare. His background is in finance, in business. So many options. Managing patient data, so people who keep records. Billing, another area. And PJC has a billing and coding, actually, whole program. I think it's only about a year long. It might be 2 years, I can't remember. But anyways, y'all already had medical technology, so it's part of it. Or you will have had after all this. Computer application, so your IT people, right? Hospitals have computers. They have to have people who know how to fix them, know how to manage the internet, and etc. So, does that make sense? Hey, what we actually see, the people who actually do the treatment, the ones we usually think of in healthcare, are way up here. But it takes all this big group of people to make them work. Takes the business part of it. It takes the people who do the billing, obviously, so they can get paid. Right? It takes the people to run the tests so that you can get your diagnosis. Support services. Okay, now this isn't like mental health support. Okay, we're not talking about like counseling type of support. It can be, but this is, read what it says. Careers in the support services provide a therapeutic environment for the delivery of healthcare. So it has to do with the environment itself. It says career opportunities range from entry level to management, including technical and professional careers. So we're talking engineers. Okay, you can't, obviously you're not going to build a hospital to look like a school, right? Every room's got to have oxygen, every room's got to have suction, every room's got to have a bazillion lights, every room's got to have a call thing in the bathroom, every room's got to be handicap accessible. You know what I'm saying? There's very specific ways to build a hospital. Ways that you want it to work for security purposes, just for functionality. Well, engineers need to know what's necessary. So you have, the hospital will have just an engineer to work on their building and that kind of thing. Maintenance staff would be support services. So wide range of education, right? So maintenance, what else? Dietary. Okay, right? If I'm the nurse and my patient is diabetic, I want to make sure that when the cafeteria brings their tray up, they bring them a tray that is for diabetics. I don't want them drinking 10 juices and eating regular Jell-O and spaghetti. Okay, their blood sugar will be 800. Okay, they need to have a diabetic tray. So somebody along the way has to make sure that they get what they need on their tray. Somebody has to plan for that. Somebody has to measure out the amount of calories and the amount of carbs that they get. There's a whole lot more that goes into it than what you think. I have another really good friend she's finishing up her nutritionist certification. She can be a certified nutritionist or a dietitian, I'm not sure. There may be a difference in those. I might make somebody mad if I said that wrong, but anyway, so there's just so many different options. She's a personal trainer, that's what she's been doing, but now she's going back to school for that, and so many options. I mean, even up here at Birchwood, where I've been taking my health science 2 students, you've got the person, the dietary manager, who makes sure that all the trays are like they're supposed to. You've got the people who work in the kitchen, and they know their job. They have specific amount of each type of food that they're supposed to put on the tray. You've got your CNAs, you've got your med aides, the ones that actually pass meds. You've got nurses, you've got the maintenance, you've got I can't think of the word. I guess it's maintenance, but yeah, I'm just going to say maintenance. But you got the business end of it all too. You got the social worker. I mean, there's just so many different things going on, Crazy to think about. And then the last one is biotechnology research and development. And this is the more the research area. So they're trying to find new medications, new treatments, what's working, what's not working. Says these are scientists who may study diseases to discover new treatments, invent medical devices. So heart-lung machine, for example, is what they do. You're going to have heart surgery. They actually plug your body into this heart-lung machine. It circulates your blood for you while they work on your heart. Okay, so any kind of devices, pacemaker, medical port, I mean, all kinds of stuff. So they are the ones that do the research. And I'll give you, this is a horrible, I know you can't see this one at all on yours, but I'll give you guys a good copy of this paper, and it's got each cluster down here, so therapeutic services, diagnostic, health informatics support, and then biotechnology. And then it's got different healthcare jobs that fit into each one. There are so many jobs on here, so I'll print this off and give it to you guys so you'll have that to look at too. What's one of the reasons that healthcare is still such a big business, do you think? And will continue to be for a little while.
At some point, everybody's gonna need help.
Everybody needs help, right? Everybody gets sick at some point. What specifically is going on right now? We've talked about this before. Do what? Well, insurance is going on right now, so who knows what kind of changes that will bring. What else? We talked about a specific population of people that are going to be needing health care.
The older.
The
Baby
baby
boomers.
boom.
Baby boomers. Y'all remember talking about that at the beginning of the year?
Yeah.
Okay, so they're all getting into their 50s and 60s, and some of them are in their 70s. So
That age.
that's the age where you tend to have more health problems. So we need more workers. Those educational requirements for future healthcare careers will depend on many factors and vary among career choices, but preparation begins now. A couple things. Let me say this and then I'll get started. A healthcare worker reaches a high-level position by a series of occupational steps. It says advancement is based on gaining additional experience, education, and clinical training. A few things. There are some, there's always nursing jobs, okay? There's always jobs somewhere. Not always the most desirable jobs, but there is always a job somewhere. But for you to get jobs that you really want, and I'm not just talking about I'm just using nursing because that's my background, but apply that to any of the careers. Your resume, and I'm not just talking about your paper resume, but what you do, you've got to broaden yourself a little bit. And what I mean by that is employers are always going to be looking for somebody who stands out a little bit. Is there something that's different about you? Is there something that's going to make them remember you? Because I'm telling you, I've worked in management, and you might get a stack of 20 resumes, and they all look the same. Everybody had awesome grades. Everybody did this or that or whatever. But the ones that stick out are the ones that have something interesting, or maybe they volunteer their time at a certain place. If you volunteer your time somewhere, they're going to think, okay, well, I know that if they're willing to work there and not get paid, they must have a good work ethic. It's not about the fact that you volunteer and they think you're an awesome person and they want awesome people to work for them. It's that somewhere behind there, there's the willingness to work. Does that make sense? And that says something. When I, especially my job at Children's, and then again at Cooper Home Health, one of the things I put on my resume was my medical missions, what I had done, working in that clinic. Well, it's not that, they want everybody to have gone to Africa and work in a clinic, but what that did is that told them that I'm flexible, right? If I can work, somewhere where we don't even have electricity, okay? Got to be at least somewhat flexible to be able to work in lots of different situations. I'm willing to, I can't think of this word, I was trying to think of it earlier. What's the word where you can use what you got on hand?
Utilize?
And that's the only word I can think of, but that's not it. It's like you use what you got. make do with what you got. Nobody else can think of it either. Y'all know what word I'm talking about?
No.
Anyway. But you see what I'm saying? It's not that they expect everybody to have done that, but it's what it tells them about me and what I'm willing to do. And so that's important. That's important for you guys to add on there. If you volunteer somewhere, if you do something different, if you win a specific award. Yes?
Off topic, how long were you there?
3 months. The last time I went, yeah. Well, not the last time, the time before the last time I went. But something that says something different. Does that make sense? Because, even like, I got way off topic. Let me go back to this. Okay, so it says a healthcare worker reaches a high-level position by a series of occupational steps. Okay, I can't tell you guys how important it is for you right now. If you have an idea of what you want to do, be looking forward. What grades do I need to have? What classes do I need to have? Am I going to have to, the PTA program over at Mount Pleasant, the A&P grade, your college anatomy and physiology grade, is 15% of points for actually getting into the program. And I guarantee you, most of the students, if not all, I wouldn't say all, but I imagine most of the students that get in, because they only take about 15 kids out of like 90 or something ridiculous like that, okay? Most of them have A's in A&P, because out of 90 people, they're going to pick the ones who can perform the best. And so that's 15% of it. Well, if you know you're going to need it and to get into the program you want to take A&P ahead of time so you can give yourself a good opportunity to do well in college. Does that make sense? So like A&P in high school may not necessarily be that big of a deal in high school that you take it, but it might really help you when you get to college, and it really does make a difference. Does that make sense? So it's important that you plan ahead. The more planning you do, the more prepared you'll be later on. One thing that kids really do, and this makes me crazy, but I'm telling you guys, this is for you, but is I feel like there's a lot of students that will go to PJC or wherever junior college you want to say, and they're really hung up on just getting done at PJC. So they'll take all these basics at PJC, every basic they can think of so they can get their associate's degree. The problem is, okay, unless you're doing a technical trade like LVN or RN or welding or what other classes? They have phlebotomy, they have billing and coding, the jewelry school. Okay, now those, obviously your associate's degree is going to be worth something because they're geared towards that. But other than that, if you want your bachelor's degree, don't feel like you have to have your associate's degree to get into a university. If you want your bachelor's degree, don't get hung up on getting your associate's degree. Don't take extra classes to get it. Now, if you can get it along the way, that's awesome. But don't get so hung up in just getting your associate's degree that you take all these extra classes you don't actually need at university. Does that make sense? No? I don't know. I just feel like a lot of people waste money doing that. So if you already know you want to go to nursing at Texas A&M Commerce, go to Texas A&M Commerce website, print out their degree plan, and it'll tell you, freshman year you need to take this and this and this. Sophomore year you need to take this and this and this. And then take that with you to PJC and take those classes. So that they'll transfer and you've taken the right ones. And you're not having to go to school for 5 years for a 4-year degree. Instead of, because if you take the pre-nursing PJC classes, they're not exactly the same as they are at A&M Commerce. So you end up taking an extra semester or a year of school there. Does that make sense? Mm-hmm. So look ahead of, if you just want to go to PJC and you want to go to PJC nursing, that's great. But then go by their plan. But if that's not your ultimate plan, you need to go to your ultimate goal and go by that. Does that make sense? Good. The other thing is, while we're talking about all this, let me tell you this on nursing. You know, at PJC, it's an ADN program, which is fine in this area, but if you ever plan on moving to the Metroplex, and I promise you don't know what you're going to do yet at this point in your life, but if you think that might be an area that you move towards, you need, if you're going to do nursing, you really need your bachelor's degree. They will not hire nurses without their bachelor's in their Metroplex, unless you have years and years of experience somewhere else. Now, if you worked at the Paris Hospital for 10 years and then you go try to get a job, sure, they might do that, but not right out of school. You can only get jobs in rural areas if you don't have your bachelor's degree. So, I want everybody to do what you want to do, but I just want to tell you that because it'll, you know, if they've got 50 applicants for this one job and 30 of them have their bachelor's and 20 of them don't, they're just going to kick the other 20 out, and they're just going to look at, that's a way for them to weed it out. Does that make sense? Okay. Nursing sense for the day. But the broader you do things, the more experience you get, the better you're going to look on paper. Not that you just want to look good on paper, but that's what they have to look at when you go in for a job or when you apply for school. So the more volunteer things that you do, the more shadowing that you've done in different areas, hey, those are things that look really good. It says, I'm willing to go the extra mile. And that's what you want to show about yourself on your resume. Not that you do the bare minimum, but that you're willing to go beyond. It says the greater your initial step into a career, kind of like I said a while ago, you know, you'll. It says determine the requirements and then make an entrance. Like I said, figure out what's required, then move forward. Okay, don't just haphazardly go through and hope that maybe you take the right classes. That's such a waste of money, and it's a waste of your time. Okay, real quick, these next few slides are, we still got about 6 or 7 minutes left. No, maybe just 5. I forgot I set my clock. These next ones are just vocabulary to kind of give you an idea of what the meaning of these different terms is. So, level 1A. Example is like a laboratory aide, or you'll hear like a home health aide. Educational requirements, they do have to be a high school graduate usually, or potentially a GED, and usually have on-the-job training. Now, as we move up, okay, so does salary. More education typically means more salary. Not always, but. Oh, the other thing is the more risk in a job usually is more salary. Somebody was saying earlier how somebody's doing they knew somebody doing some underwater welding and making, oodles of money. But,
you cover the 100%
exactly, okay, that's why they pay so much, because people don't want to do it. It's not worth the risk if they're not going to give them enough money. Okay, so next we go up to assistant. So, for example, laboratory assistant, up to 1 year of classroom and clinical prep. So, even like a certified nurse assistant, a CNA, and this is an example. CNA at PJC is like a 2-week, 2 or 3, I think it might be 3-week course, actually. Cost, I'm not sure how much it costs, $500 or $600, I think, maybe more. Phlebotomy would be another example that's in this assistant realm. Okay, but if you don't want to go to school, if you just want to go to school for a few months, there's some really good jobs out there. Okay, a technician. Okay, minimum 2 years in the classroom or a 2-year training program, surgical tech. Okay, now a radiology technician is actually a person who works on the machines. I was informed that by a friend of mine. Anyway, like a laboratory tech. So it's a shorter training period. PJC is going to offer programs like this. Really good option for somebody who doesn't want to get a full 4-year degree but wants to go to school and have a specific trade to make more than minimum wage. Okay, really good examples of how to do that. Okay, a technologist. This is like a radiology technologist, for example. We're talking about radiology technologists. They're the ones that actually take the x-rays. Okay, a lab tech, this is 3 to 4 years of college plus some work experience. Of course, you have to get the experience first, but typically that's what you'll see. So same thing with the radiology technologist, usually 3 or 4 years of school. Okay, a professional pathologist, for example, talking about all of these are in like the laboratory kind of realm. A 4-year degree, an advanced degree, and clinical training. So moving up again. A registered nurse, by the way, is considered a professional. LVN is not. Changes it a little bit. Yeah. Do you have any questions? That's kind of long and dry, but